Diphtheria is a serious infection caused by strains of bacteria called Corynebacterium diphtheriae that makes a toxin. It is the toxin that causes people to get very sick. Diphtheria bacteria spread from person to person, usually through respiratory droplets like from coughing or sneezing. People can also get sick from touching infected open sores and ulcer. Those at increased risk of getting sick are people in the same household, people with a history of frequent close contact with the patient, people directly exposed to secretion of the suspected infection site of the patient. In a bid to halt further spread of diphtheria outbreak in Nigeria, the Federal Ministry of Health, in collaboration with the National Primary Healthcare Development Agency and the Nigeria Center for Disease Control and Prevention (NCDC), supported by the United Nations Children's Fund (UNICEF), disclosed that a total of 1,692,762 children ranging from 6 months to 4 years of age have been diligently administered the pentavalent vaccine, which serve as a vital safeguard against diphtheria disease, adding that over 3 million children aged 4 to 14 years have received the TD vaccine to further strengthening safeguard from the disease. The ongoing vaccination phase has made a tangible difference in protecting the lives of 4,859,181 children across affected states.
1,111,310 children with TD vaccines and 544,737 children with pentavalent vaccines in this phase 2. Katsina, another hotspot in this outbreak, has vaccinated 403,252 children with TD vaccines and 255,075 children with pentavalent vaccines. Similarly, Kaduna, Bauchi, Borno, Jigawa, and Yobe have not faltered in their efforts to ensure that vaccines reach kids in these local government areas. By so doing, we're collectively securing the health and well-being of hundreds of thousands of children through dedicated vaccination campaigns.
Katsina, which is another hotspot in the diphtheria outbreak, has vaccinated 403,552 children with the TD vaccine and 255,075 children with the pentavalent vaccine, while Kaduna, Bauchi, Borno, Jigawa, and Yobe have not faltered in their efforts either, collectively securing the health and well-being of hundreds of thousands of children through dedicated vaccination campaigns. The Director General of NCDC, Dr. Ifedayo Adetifa, disclosed that as of 19th of October 2023, there have been 15,060 reported suspected cases of diphtheria, out of which 9,478 were confirmed cases from 137 local government areas in 20 states, including the FCT.
As we are aware, the outbreak started much earlier in Kano and continues, so Kano has most of the cases. There are now other states, Yobe, Bauchi, Katsina, Borno, Jigawa, Kaduna, that have now contributed cases, and together these 8 states are responsible for over 95% of all cases reported so far. Of the 9,478 cases, 71 or about approximately 72% are aged 1 to 14. Now, in terms of a breakdown for you to fully understand the most affected age group, the infants that have been affected in this outbreak constitute less than 1% of all cases. Those that are under 5, that is aged from 1 to 4, constitute 14% of all cases. Now, the age groups that are most affected are the 5 to 9 year age group, which make up 31% of cases, and then the 10 to 14 year olds that make up approximately 27% of all cases. Older adults are not spared. Those that are aged 20 years and above constitute 16% of the cases. So in terms of those mostly affected, 5 to 14 year olds are bearing the brunt of the outbreak.
In a special interview with Coordinating Minister of Health and Social Development Dr. Alupati, there are indications that the government has not only taken drastic steps against matter of public health concerns, but has put measures in place to nip diphtheria in the bud as it continues to collaborate with key stakeholders across and beyond the sector.
We are going to work with it very closely as the federal ministry, because it's part of the ministry, and the states, to train the epidemiologists, to strengthen the laboratory systems, to ensure the surveillance systems work, and that there is quick communication and coordination, not only within Nigeria, but within the sub-region, as well as outside. So that things like genomic surveillance, so that when pathogens, when new diseases come out, we know what they are very quickly.
Tackle them early enough.
Tackle them early enough. Whether it's diphtheria, whether it's cholera, whether it's Lassa, whatever pathogen comes, we should be able, as a country, as a matter of our own national security, actually be able to get a handle on it and get the support of some of our partners like the World Health Organization and others, and Africa Center for Disease Control, to really tamp it here and also protect our borders from getting diseases that can come to us.
It is the hope of Nigerians that the fight to stop diphtheria is not a matter of when and not if. Fauziya Lukman, reporting for Global TV News.